Good morning, Dr. Sharma, and welcome again to another session on brain health.
And good day to you, Dr. Vasconcelos. Good to be back with you.
Doc, today is November the 24th, 2020, and just last week we celebrated World Children Day. And our children right now, young people, are facing a lot of emotional, social, physical isolation due to COVID-19. As a mental health expert, what are some of the things that we can do for our young children? And also, what are the possible negative impacts this situation can have on their lives?
So let's take the negative impacts, and you're right that they are faced with a huge change in the way their lives are structured, and it's been very, very hard on them, particularly. It's hard on the family, and when it's hard on the family, the children will feel it. So you got lockdown situations where children are at home and they're not able to go back to school as they would usually do. So they're missing the school environment. And while the teachers are doing their best using audiovisual mechanisms to teach, it's just not the same. There's not that social contact that they would have loved, and teens particularly like that. They miss the physical also, where they can be close to each other and have that interaction. So it's taking a toll on them. Just recently we heard the tragic news of a teenager in Baltimore, and the video is there on the website, where the parents are talking about how horrible it has been for them to hear how he took his life because of feeling the effects of the lockdown, and how his grades spiraled from a top student, and also that some of those red flags that were there were not picked up. And people tend to sort of brush this thing off and take it a little bit lightly and say, well, these kids have to just bounce back and make the best of it. But it's, as I said, the pressures are on the family too, because people are losing their jobs. Those people who have fairly secure jobs, they just can't understand what's happening to people whose jobs are affected. There are many areas and avenues of life that are troubled and now totally messed up and spoiled. So these kids, as you said, go through significant isolation. And young people, adolescents, teenagers, they always find it a little bit difficult to communicate their emotions. They feel sometimes the parents will not understand what they're feeling and what they're going through, and may even try to pull them up and say, well, you got to be strong and you have to be tough and toughen up and cope and look at the other kids, what they're doing. And there's also this pressure on kids that they have to maintain that high level of performance, which they seem to be also struggling with. I just saw a young student, and thankfully his mom recognized that he's showing signs that were not good emotionally, where he wasn't keen to do his work. And so those are some of the red flags that we see, that a drop in performance is definitely one. Lack of interest in regular activities or a loss of appetite, changes in sleep habits. They're tending to sleep very late now, these children, and sometimes even going to bed after the parents have gone to bed. So God knows what they're looking at on their cell phones. And the cell phones are becoming an obsession for them because it's a distraction. There's always something pleasant or exciting to look at, or a game that takes up their mind. And I've seen even children as young as 11 who showed brainwave changes because of the excessive use of cell phones. And one child actually, several children actually, showing up with some kind of seizure phenomena, temporal lobe type seizure phenomena related to the excess use of cell phones. So it's very hard, and especially if the parents may not be around, or they have to rely on some other person to be there who may not show that intimate interest. The school environment was very protective and caring. So I'm just hoping that down the road we can get these vaccines and that we can have life return to normal, because this is certainly not normal. And when there's not a normal situation in life, children are becoming fearful of the future, what's going to happen to them in terms of occupation when they see their parents losing their jobs, what's going to happen to them? Is it worth this their life? Is it so precious that they should keep it? And when they get into a severe depression just takes control over the person's will, and the judgment becomes distorted. And suicide may be a way out, and that's so unfortunate and sad. So what can we do about it, Doc? And I think a very critical thing is for the parents to be involved. Parents themselves start to go through a bit of emotional isolation and distress, and they find it hard to monitor the child's performance. And they may just ask, "Are you doing okay?" And the child says, "Fine, I'm doing fine," but they won't sit and check the work and see that the child is actually not performing at the expected level. So not to find fault with our teachers, they are under a lot of pressure teaching in a new style, trying to cope with preparing lessons and evaluating. So they've got a full class of students to go and evaluate through this new method, and it's tough on them. So we really need our parents to be absolutely connected emotionally, be able to interact with our children so they can get off those cell phones and do as much as they can in terms of physical interaction, help the child to develop empathetic skills and skills in terms of motivation through emotional intelligence programs. Like there are quite a number of them on the internet that they can pull down and play with the kids. Simple interaction, like Simon says, having the child show emotional expressions and how would they react to somebody who is looking sad or who's looking down. What does it mean to them? So spending some time with the child is absolutely critical. Getting those children to talk their feelings, and if they find the child is not able to open up, then let the experts meet with that child and let them see the child early. I just saw this young student, and he's obviously so bright, but he's lost his interest in schoolwork, and feeling that it's too oppressive and the expectations now are too much, and to show him that he's very bright, build his confidence. So there are strategies we can use to help them to recover emotionally. But the biggest thing there, Doc, is the hope that we must let our people know that there is hope. The media is portraying such a negative and pessimistic view of life. We all start to feel down if we just listen to this doom gloom horror story that this, you hear the word spikes and all kind of negativity. We're not hearing the successes and the number of cases that are recovering